Good evening. It's Dr. Ariyo here with another session of Health Talk. So, the past few weeks we've been learning lots together on the topic of obesity, being overweight. We've learned about why it is important to lose weight so that we can avoid some of the health problems that can happen. Last time we were here, we talked about the role of diet in obesity. And we learned that actually if we consume too much calories in the form of food and drink and we don't use it up at the same rate, we run the risk of gaining weight. So today we are going to be looking at exercise and obesity. Why is having a regular physical activity or exercise important when it comes to being overweight? So welcome on board. I hope that we're going to learn a lot together today. So, what is physical activity? What are we talking about? We're talking about anything that involves physical effort with the aim of actually improving your fitness and health. What are the benefits of exercise? Well, there's lots. But for the basis of this topic, one of the first things that you can gain really from exercising is to lose weight. And why is it important that we lose weight? We learned last time that actually being overweight drives diabetes, which is a very serious health problem. About 90% of people with diabetes are actually obese or overweight. And we said that diabetes can increase your risk of heart disease, high blood pressure, and so many more things. We also know that 85% of high blood pressure is actually related to being overweight. Another health problem, did you know 10% of all cancers in people that do not smoke is actually related to being overweight? So there's so many serious health problems that if you are overweight you can encounter. There's things like sleep problems, there is breathing problems, there's depression, joint problems, and many more serious problems. So actually losing weight, if you can lose weight, you'll be doing yourself a great favor in terms of your health. Now you may be wondering, what should I be aiming for, when it comes to exercise? How much exercise should I be doing that would ensure that I actually lose some weight? Well, the recommendation is that actually we all need to lose weight and we all can benefit from exercise. Yeah. So whether you are a healthy weight, which we learned how to work out last time, or whether you are overweight, exercise overall is good for all of us. Okay. Because apart from reducing your risk of heart disease and diabetes and all the serious problems, exercise generally strengthens your muscles. It gets you moving. It's good for your heart. It's good for your breathing. So whether you're overweight or not, exercise is good for you. But if you are overweight, what you should be aiming for really is that you want to do exercise that will help you to lose about, more than 5% of your weight. That's what you are aiming for, okay? And when we talk specifically about what type of exercise you should be aiming for, you need to be aiming for what we call aerobic type of exercise. So you want to do exercise that gets you your heart beating faster and also gets you out of path. So things like just walking is not, it does help to move your joints and your muscles, but actually you don't feel out of breath, and your heart is not racing. So you want something that would get your heart racing and make you feel breathless. So aerobic type of exercise. And the recommendation currently, and actually that's in the whole of UK and actually worldwide, because when I was looking at literature in America, all over actually, the recommendation, from health perspective is that actually you should be aiming for at least 150 minutes of exercise, moderate aerobic type of exercise. 150 minutes. Guess what? Not in a day, in a whole week. Okay, so that is not a lot at all. 150 minutes, okay, of exercise in a week. That's if you're doing moderate type of aerobic activities. And when we say moderate, we mean activities that um, will get you breathless. So, for example, activities that if you're doing, um, you can still talk, but you can't sing a song, for example. Yeah. So we're talking about things like cycling, because I could be cycling and talking to my friend next to me. Okay. But if I try to sing a song, which I'm not going to do now, I probably it will be difficult to do. So that's moderate type of aerobic activity. So cycling is one of them. You can do brisk walking, because often you hear people say, oh, I walk a lot, I and that's for my form of exercise, but I'm not seeing any weight loss. It's actually because you're not really doing a lot. You're just moving, but you're not engaging, you're not causing any burning of calories. Yeah, remember what we said last time with diet. Yeah, what you want to do really with exercise is that you want to burn the calories, the excess energy that you've stored up as fat. You want to burn them, so you want to do an activity that would encourage that. Okay. And so doing things like cycling, things like volleyball, I said things like cycling, things like volleyball, things like swimming. If, for example, if you're a fast swimmer, it will be a more vigorous activity. But if you're a kind of beginner swimmer, even any level of swimming can help with that. Okay. And then in addition to that 150 a week, what you need to also do is to do activities that will strengthen your muscles. Okay. And you only need to do that 2 days in a week, so you don't need to do it throughout the week. Okay, 2 days in a week, something that will strengthen the muscles and get the joints moving. Okay, so you can do things like squatting, things like bench press ups, you can do like climbing up the stairs, you can do weightlifting. And we're not talking about heavy lifting, because I don't do heavy lifting. All right, but you can do, if you have like can of beans at home, or tomatoes, or cans that you haven't opened, basically they do have a bit of weight. Okay, so you can use that. And basically when you're doing muscle strengthening exercises, you want to do them in sets and repetitions. Yeah, so for example, if you're going to be lifting, you have a can of beans in one hand, one here, you might be going up and down, but you might decide that I'm going to do 20 times, then have a pause. Okay, repeat that. Yeah, and really the guideline is that you should do it in a way that you get to a point where you can't go you can't repeat that cycle. So if I was doing 10 times of that, I want to do it to a point where I'm so tired, yeah, that it's difficult to then repeat the next set of 10. So you take a pause, then you repeat that. Okay, now if you were able to do that, just you do that 5 sets of that, and then you do that every day, or even just 2 days in a week, that's you strengthening your muscles. In addition to that, you might decide you want to do crunches, you might do sit-ups, whatever you want to do, just to strengthen your muscles. Okay, that is your exercise done. So your 150 minutes a week, you can then spread it out, so you can do 30 minutes a day. Okay, 30 minutes a day is not a lot. We have 24 hours in a day, so you can afford to fit 30 minutes a day into your of exercise into your day. And the good thing to do is to put in your routine, make it part of your routine. So it might be in the morning, you wake up, the first thing you want to do, you want to spend 5 minutes, do your muscle strengthening exercises. So you can do your sit-ups, you can do your crunches, you can do your squats, hop into the bath, have your shower. You've done that already, that's done and dusted for the day. If you're going to take a bus, instead of maybe walking to the nearest bus stop, why don't you do a brisk walk to the 2 stops before, while you're waiting for your bus? Because sometimes you have to wait for the bus. So instead of just standing there not doing anything, put your 5 minutes of exercise in there. You've done your brisk walk, you've done that already, you've done it. If you are at work, you have the lift. Often most of us will go for the lift, the stairs. Why don't you go up the stairs? That's another few minutes of exercise you've done. And I know now some people, when they even are on their lunch break, they have a gym nearby, they might go for a jog, or they might go on the treadmill, and then they go back to work. So you can actually incorporate your exercise into your daily routine. Yeah, if you go for shopping, for example, some of us, we're used to pushing the trolley. So if what you're going to buy is not really a lot that you need to have a trolley, why don't you take the basket, put that's a form of weight you're lifting that day. Yeah, some of us women especially, we carry handbags, use that as your weight. So you're going to be at work during your break time, why don't you use that as your weight lifting? So there's so many ways that you can get creative with doing your exercise and make it part of your day, and then you actually enjoy doing it. So apart from doing 150 minutes, okay, of moderate aerobic type of activity in a week, you can either do that, okay, plus the strengthening exercises, or you can do 75 minutes of vigorous activity. So this is a bit more high intense. So instead of brisk walking, we're talking about jogging, running, football, yeah. We're talking about tennis, all right, single tennis, yeah. So anything that sort of requires more energy, makes your heartbeat even more faster, and makes you more breathless. So this kind of activity, you will definitely not be talking to someone, okay? You're going faster. For example, if you go on the treadmill and you're going really at a fast rate, you don't have time to be singing or have time to be talking to anyone. So this is the kind of activity. But because from evidence, actually vigorous activity, if you do 1 minute of vigorous activity, yeah, you get the same benefit as if doing 2 minutes of moderate activity, yeah, because it's more high intense, so you lose more calories, okay? So it's either 150 minutes of the moderate form of activities, okay, per week, which works out roughly to be about 30 minutes a day, or you can do 75 minutes of the vigorous activity per week as well. In addition, you need to do your 2 days a week muscle strengthening exercises. So this sort of level of exercise helps you to keep fit, keeps you healthy, and maintain your weight. Now, for someone who may be obese, who needs to lose more weight, you actually need to increase that minutes of exercise that you do a week, okay? So the recommendation, when I looked in the literature, all around, it actually says you need to do at least between 200 and 300 minutes of exercise a week, okay? So ideally, if you can do at least an hour of either moderate aerobic type of activity or vigorous type of activity, okay, or if you do even a combination of those, because you might find that it's so difficult to actually keep up with the vigorous activity. So you might want to do a combination of sort of gentle, aerobic activities versus the high intense. So if you can do at least an hour of that a day, you would definitely see results. Now, is exercise alone enough to lose weight? The evidence suggests that exercise is good to help you lose weight, yeah, but to really lose significant amount of weight and to be able to maintain it, you need a combination of your diet changes, which we discussed last time, and your exercise, okay? They've looked at studies where they just looked at diet alone, actually reducing your calorie intake, all right, versus just exercise alone, and then looking at a combination of exercise and diet together. And actually, if you just make significant changes to your diet, i.e. reduce your calorie intake, all right, like we said last time, your energy consumption, if you reduce it significantly, actually you can lose quite a lot of weight compared to just exercising alone and not making any diet changes, okay? However, if you also do a combination of your exercise and diet, you can also lose significant amount of weight, okay? And like I said, exercise actually is not just for weight loss, because it can help you to lose weight, which is fantastic, and you can get all the benefits from the health point of view, but exercise generally is good for you and you gain other benefits from it. I hope that all that makes sense, yeah? So I would say that, in going forward, in terms of wanting to lose weight, we know that obesity can cause a lot of problems, okay? So we want to avoid it as much as possible. So what we should be aiming for is to make changes in terms of our diet and make changes in terms of our physical activity, i.e. exercise, so we can gain optimum benefit in terms of weight loss, which will transfer in our health. We'll be able to reduce our risk of heart disease, reduce our risk of diabetes, reduce our risk of stroke, reduce our risk of cancer, reduce our problems with mobility, reduce the risk of having difficulty with breathing, and all the problems that can come about. So I hope you have learned a lot today. I would say that enjoy this journey. Like I always say in my talks, that when it comes to your health, it's a long-term journey. It's not a quick fix. It's not a microwave thing. Okay, you need to work at it and take it at your own pace, especially when it comes to exercise. For some of you, 30 minutes a day might be too much for you. Not because you're busy, because I think busy is just an overrated word, because you can fit it in if it's important to you. If your health is important to you, then definitely you can fit it in. But it might be too much for you because at this stage in your life you might not be fit enough to even do 30 minutes of exercise, which is fine. Take it at your own pace. Start slowly. It's your journey. It's your personal health journey. So you can start with 5 minutes, 10 minutes, okay, of doing this exercise. It's the consistency that matters. Make sure you stick at it. You keep at it. Keep your eye on your health goals, paste it on your wall, and work with it. And you will see the results. And recently, one of my viewers, she posted a picture on her profile. She was so happy because she had made some changes to her diet, and she had actually seen some results. Even though, like she rightly said, she said, it's not a big, weight loss, but she was happy with the little that she had lost. And that was a motivation for her to carry on. And I was so proud of her. And I sent her a message to just encourage her. And that's what it is. It is all about, It's like everything in life, it can be difficult. But if you put your mind to it, then you can do it. So this is about your health. Your health matters, okay? So thank you for tuning in tonight. There's going to be many more exciting topics coming up about your health. So you're going to learn more. Please do like my videos. You can also watch the video clips on YouTube. Just type in Dr. Ariyo and you'll be able to see them. And kindly share with your friends, because health is something that applies to all of us, no matter your status, no matter your age, no matter your background. We can all benefit from it. So please share with your friends, share with as many people as you know, and get people to watch the clips as well so they can benefit from it. All right, so thank you for tuning in tonight. You've been listening to Dr. Ariyo again on obesity and exercise. You can look at all the previous clips as well on my Facebook page and on the YouTube channel as well. So thank you. Stay well, keep well, please keep going, don't give up on your health journey, and I hope to see you soon again with another fantastic topic. I will tell you soon. All right, bye bye, good night.